What if two people have the same type of cancer in the same organ at the same stage but need completely different treatments? Sounds unbelievable, right? For years, doctors treated cancers mainly based on where they started in the body. But today, medicine has discovered something remarkable, that every cancer has its own genetic fingerprint. And by decoding that fingerprint, doctors can identify treatments that are more personalized, more precise, and even more effective. Welcome to the fascinating world of molecular testing, a breakthrough that's changing the future of cancer care. Dum, 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 dum. Welcome to Everything About Cancer with Doc Fred Ting.
New episode every Wednesday.
And Saturday.
Hi everyone, I'm Doc Fred Ting, your medical oncologist, academician, researcher, and health system shaper. And welcome to Everything About Cancer, kung saan tinatanggal natin ang takot sa pamamagitan ng tamang kaalaman. Today, we're exploring one of the most exciting advances in modern oncology, molecular testing in cancer. So what exactly is molecular testing? Molecular testing is a laboratory method used to analyze cancer cells at the genetic and molecular level. Instead of simply looking at a tumor under a microscope, scientists examine the DNA, genes, proteins, and other molecular features inside cancer cells. Think of it this way. A traditional biopsy tells doctors what the cancer looks like. Molecular testing helps explain why the cancer behaves the way it does. It identifies specific genetic changes, often called mutations, that may be driving cancer growth. So why is this important? Because certain mutations can be targeted by specific treatments. And this approach is known as precision medicine or personalized cancer treatment. Palagi kong sinasabihan ng aking mga pasyente na ang paggamot ng cancer ngayon hindi na gaya ng dati na dekahon. Ngayon, we try to look at the tumor biology, ano bang ugali ng iyong cancer, para mapagplano natin ang the best treatment option available. So instead of using a one-size-fits-all approach, doctors can now select therapies that are designed to target the unique characteristics of a patient's cancer. For example, some cancers may have genetic mutations that make them more likely to respond to targeted therapy or immunotherapy. But without molecular testing, doctors may not know those treatment options exist. So how is molecular testing performed? Usually, a sample from a biopsy or surgery is sent to a specialized laboratory. In some cases, doctors can even perform what's called a liquid biopsy, which analyzes cancer-related DNA circulating in the bloodstream through a simple blood test. The laboratory then searches for important biomarkers, molecular clues that can help guide treatment decisions. Some common questions that molecular testing can help answer include: are there targetable mutations? Which treatments are most likely to work? Is immunotherapy a potential option? What is the likelihood of responding to specific medications? Now, this information helps us, doctors, create a more individualized treatment plan for each patient. It's important to understand that molecular testing is not necessary for every cancer type or every patient. Whether it's recommended depends on factors such as the type of cancer, the stage of the disease, and available treatment option. That's why it's always important to explore these tests with your doctor and with your oncologists. Now, molecular testing represents a major shift in how cancer is treated. Instead of focusing only on what cancer started and where it started, doctors can now learn what's happening inside the cancer itself. This deeper understanding allows healthcare teams to make more informed decisions and may help avoid treatments that are less likely to be effective. In many cases, molecular tests opens doors to newer therapies, clinical trials, and treatment strategies that were not available a few years ago. If there's one thing to remember from today's video, it's this: knowledge is powerful. Every discovery inside a cancer cell gives doctors another opportunity to fight smarter, personalize treatment, and improve outcomes. The future of cancer care is becoming more precise, more targeted, and more hopeful than ever before. For patients and families facing uncertainty, advances like molecular testing remind us that science continues to move forward, bringing new possibilities with every breakthrough. Some of you might ask, Doc, meron ba ng molecular testing in Bacolod? The answer is yes. Your oncologists know best how to guide you, how to facilitate those testing, even if it's being sent to Manila, to Singapore, to UK, to Germany, to Hong Kong, or to the United States. Your oncologists are able to facilitate this for you without even leaving Bacolod City. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with others. Stay curious, stay informed, and remember, every answer uncovered through science is another step closer to hope, healing, and a brighter tomorrow. Always remember, let your faith be stronger than your fears, because cancer is not a death sentence and there is always hope. Thank you for watching Everything About Cancer with me, Doc Fred Ting. If you found this episode helpful, please like this video, share it with your family and friends, and subscribe to the channel so we can spread accurate and reliable information about cancer to more people. Don't forget to click the notification bell so you won't miss our upcoming episodes. And always remember, let your faith be stronger than your fears, because cancer is not a death sentence and there is always hope. Again, I'm Doc Fred Ting, and see you in the next episode of Everything About Cancer. Welcome to Everything About Cancer with Doc Fred Ting.
New episode every Wednesday.
And Saturday.